that's continuing uninterrupted at this point in time. But again,
experts here with us. Once again, good morning. Today is day 3 of our 4-day lockdown. By staying home, we're giving our contact tracers and testing teams time to do their essential work and ensure we find every potential local case. I'd like to thank every Western Australian for doing the right thing. Because you've stayed home where necessary and followed the rules. Worn a mask, checked in on the Safe WA app. It means we have the best possible chance of getting on top of this outbreak. We just need to keep it up for a little more time. This morning I can confirm that WA has recorded no new local cases of COVID-19 overnight. Just to repeat, there have been 0 new local cases of COVID-19 overnight. This is amazingly encouraging news, and I'm sure it's a relief for many families. It puts WA in the best possible position, especially as our contact tracers continue to find more potential contacts. 360 close contacts have been identified in the community cluster, of which 295 have tested negative so far. In addition, 2,503 casual contacts have been identified and 1,173 have tested negative. It is important that every Western Australian keeps checking the website for any new exposure sites. New sites and times will be added when necessary, along with what actions people need to take. We want to find as many potential contacts as possible. When it comes time to lift restrictions, we want to be confident this incredibly infectious virus, the Delta variant, is not still in the community. With regards to tests, 15,809 tests were conducted yesterday in Western Australia. This is a very large number, but the next 24 hours are crucial. I'd like to appeal to every West Australian. We need you to get tested. If you're experiencing symptoms, if you've been to an exposure site, even if you've already tested negative and then subsequently developed symptoms, we want you to get tested again. If you're worried about being in a queue, there are plenty of clinics around Perth with very short wait times. Please, even if you think it's nothing and not worth it, go get tested. I want to thank everyone who has done the right thing so far. The more people we get tested, the more confidence we can have when taking the next steps. With regards to travel restrictions, I can advise that since our road checkpoints were set up around Perth and Peel, as of 2 p.m. yesterday, 28,924 individuals have been stopped, and 262 of those were turned around. Travel restrictions are incredibly important. It has allowed essential workers to continue to do the job we need them to do, but prevented large unnecessary movement. That's helped keep WA safe. The last thing we want is this deadly virus getting out into our regional and remote communities. I'm aware of reports of tourists disregarding restrictions and signage and entering remote Aboriginal communities in the Kimberley. This is completely unacceptable, not only for the health of local Aboriginal people, but it is disrespectful to those communities. Since the pandemic began, we have worked side by side with remote Aboriginal communities on restrictions. If communities wanted to remain closed to non-essential visitors, we respected and helped enforce that decision. No one wants a COVID outbreak in a remote Aboriginal community. Tourists need to follow the rules like everyone else. Just in closing, I want to say thank you to everyone in Perth and Peel and right around WA for doing the right thing. Lockdowns may be necessary at the moment, but they aren't easy. They're tough. I can tell you though, we are on the right track and we hope to have more to say about the next steps we're going to take tomorrow. But there's one more thing I'd like to ask of everyone. It's not in the health advice, but I know it's important. These are tough times for small businesses. Today, tomorrow, if you can, please support a local small business. Whether you grab a coffee after your daily exercise or get a takeaway for dinner tonight. It will mean so much to these small businesses and their staff. I know that some of the exposure sites in this outbreak are popular local businesses themselves. They've had a lot of attention in media this week, but not for the reasons they wanted. And it's not through any fault of their own. It is important to remember they'll be deep cleaned and their staff quarantined and tested. When the time comes for them to reopen, they'll need their local support more than ever before. No cases of COVID today is good news, so we just need to keep up the good work a little longer. So please stay home when you can, stay safe, get tested, and importantly, get vaccinated. Thank you, and I'll hand over to the Health Minister.
Thank you, Premier. Thank you very much, everyone. Can I start today just by thanking all the nurses and staff at our vaccination centres. I'm constantly getting feedback from people on just how calm and professional the staff are in our clinics, even when it's extremely busy. So thank you very much for your efforts. Our clinics draw upon nurses and staff from right across the health system, and we thank them for standing up these great clinics on behalf of the people of Western Australia. Briefly today, just on vaccination, yesterday was another record day for vaccinations. 12,774 people were rolled up for WA. 7,594 at our public clinics, 5,180 at our private clinics. We now have 720,000 people in Western Australia who have at least received their first dose. 299,121 of those were done in our public clinics. Health has some 360,000 vaccination appointments booked in the coming months. These bookings mirror the availability of vaccines and is really, I think, just an indication of just the work that we have ahead of us. So everyone, please, let's keep the momentum going. This is important work. On Safe WA, we're also seeing consistent numbers for the Safe WA app. There were 1,190,996 check-ins yesterday. This is similar Wednesday when we had just 1.2 million scans. Almost 2 million Western Australians have now downloaded the app, with 80,000 businesses registering on the app as well. The total number of scans so far is 267 million. So as I keep saying, make Safe WA a habit. It's invaluable data for our contact tracing teams and is the reason why we can get on top of these outbreaks wherever they occur. Scanning in takes no time at all and it makes a difference. Just turning to wastewater testing. Under the Wastewater Surveillance Program, weekly testing has been ongoing since November 2020 at 6 of Perth's wastewater treatment plants at Subiaco, Woodman Point, Alkimos, Beanyup, Gordon Road and Point Perrin, and of course we have a regional testing program as well. Until now, the only positive results we've seen have been at the Subiaco plant. These have been expected because this plant treats wastewater from the city's quarantine hotels, where we have regular positive cases from returned overseas travellers. This week, for the first time, we had a positive COVID-19 result detected at the Alkimos wastewater treatment plant. 2 known active cases from the Mindari community outbreak live in this catchment area of about 82,000 people. So the result was to be expected. The frequency of testing has now been stepped up to 3 times a week because of the current community cases that we're experiencing. There will also be some additional testing in sub-catchment facilities just to gain more area-specific insights and to make sure that we can detect any presence of the disease in wastewater. So to be clear, we have no positive wastewater results outside the northern suburbs treatment plants. Finally, don't forget to practice good personal hygiene. Keep wearing a mask outside the home at all indoor settings, on public transport and outdoors at all times, unless for vigorous exercise. Anyone who has travelled outside the Perth and Peel area and Peel region since Sunday must continue to wear face masks in public. If you are feeling unwell or if you've been to an exposure site, please get tested and quarantine. Even if you have returned a negative result previously, if you are feeling unwell, get another test. It's so important to make sure that we have all the information we need to stay on top of this outbreak. Happy to take health questions.
Are any of the positive cases at the moment sick or sick to the point where they will require any further healthcare?
Not that I'm advised. As you'd be aware, some of them are quite young, in their 30s, and case 1029-222 is an older person, but my understanding is she's just resting at home.
Of all the people who, of which I think it was yesterday was 43,000 from Sunday, and it's now another 15,000 tested yesterday.
Yeah.
How many results from all of that testing
Have you got the results?
have you had?
Look, I deeply apologise, Jeff. We were going to bring that information today. We don't have it. We'll get that to you hopefully before the end of the press conference.
Okay, is it a lot?
How many have been tested?
Well, no, I know how many have been tested.
Yeah.
We know that. How many results
Oh, the results
have been
in terms of
evaluated?
negative results?
Well, in terms of any, they're all negative
Yeah,
because we don't have
that's
any
right,
cases.
Yeah. So, well, I could characterise it this way. Almost all the close contacts have been tested and returned negative results. Or the negative results from casual contacts is sitting around about the 50% mark. As I said, we'll have that information for you before the end of the press conference.
So I'm talking about the people who, not the casual or the close contacts, they're in the hundreds.
Right.
I'm talking about the thousands of people who drove through and spent hours in a line.
My apologies, yeah.
How many of those results have you got back?
Well, look, each result at the moment is taking around about 24 hours to return those results. So you could anticipate that we're getting tens of thousands of results back on a 24-hour basis. So remember, we did, I think, 18,000 yesterday, the day before yesterday, 14,000 the day before that. So you could anticipate pretty much all those results would have been returned by now. So apologies for them.
No, sir.
Just okay. Some of the viewers would like to ask why the Redcliffe Vaccination Centre is closed, and she says that she has the first Pfizer, but then has to wait for another 6 weeks for a second appointment.
Well, in relation to Pfizer, it's certainly not a 6-week wait. So what we do when people go to a vaccination clinic and they get their first jab is that we encourage them to book their second jab in at that time. I'm not sure about the opening times of the Redcliffe clinic, but obviously we have slots right across the metropolitan area for people to get their first and second doses.
Some have also asked on vaccination centre, is it possible to operate them for 24 hours?
No.
Why not?
We simply do not have the workforce to be able to do that. We also have appointments available consistent with the supplies we have available of Pfizer. So if we could open up at 2 in the morning, doesn't necessarily mean that we'll have medications for people at that time.
The chief vaccines have been administered this week.
Okay, so well, I can give you yesterday and cumulative.
Yep.
So yesterday we had 6,094 first dose of the Pfizer vaccine, 772 of the second dose. We had 2,205 of the AstraZeneca vaccine and 3,703 of the AstraZeneca second dose. That's for the total of yesterday. And can I just emphasise once again how important it is if you have had your first dose of the AstraZeneca vaccine, you must get your second dose. It is so important in terms of making sure that you were fully protected. The Premier and I have received our first dose of the AstraZeneca vaccine. We will go and get our second dose when we're due. It's so important that people get their full vaccine dose.
There's been a suggestion, and you might be able to confirm whether it's true or not, that prisoners at Carnot are going to be vaccinated. Why prioritise prisoners before homeless people and rough sleepers?
Okay, so WA Health has started a program this week to vaccinate staff and inmates at WA prisons. This is consistent with the national program that was agreed with the Commonwealth. The vast majority of the people in WA prisons are under 60 years of age, making Pfizer the most appropriate vaccine. The nature of prisons, people living and working in close proximity, places though in these locations people are at high risk. And should COVID-19 enter a prison, we would go through that prison like wildfire. Other vulnerable populations, for example, like aged and disability care residents and remote Aboriginal communities have all been provided Pfizer.
So are prisoners under 40 getting the Pfizer vaccine now?
I can't advise in relation to under 40, but I'd imagine so, because what we want to do is make sure that we don't have big outbreaks across our prisoner population.
So prisoners under 40 are being prioritised ahead of non-criminals under 40?
No, vulnerable populations are being prioritised, consistent with the agreement with the Commonwealth.
Is there a camp? I mean, do you have people actually going out and actively vaccinating the homeless and the rough sleepers?
Look, we do have people that are working with the people in our most disadvantaged communities to make sure that we can reach out to them, and I understand there's a specific program within health for that, and I'm happy to provide details of that.
On the vaccine usage, it appears WA has the lowest usage of all the states and territories at about 78%. Does that concern you, and what's happening in WA?
By usage, do you mean that with
Stock
the stocks that
usage?
we have?
Yeah.
Well, look. As you'd be aware, previously we have opened up our vaccine programs to people over 30 even. And subsequent to that, consistent with the National Cabinet decision, open up to 40 to 49s and 50 to 59s. We've got a significant penetration of our population. On the last statistics I saw, we had a higher proportion of our population vaccinated than any mainland state. So we're making good progress. The quantities that we have in reserve are carefully managed by the Department of Health to make sure that we have quantities consistent both with the demand into the future for first doses and the need to make sure that we have doses for second doses.
Precisely as to what has been done to ensure that Aboriginal people are included in the lockdown and the vaccination conversations, because yesterday some advocates told me they haven't even heard that people above 16, Aboriginal people, Torres Strait Islanders above 16 can get the vaccination. And then the AMA on the Q&A yesterday says that the way that the government try to promote is very vanilla, in a very vanilla approach. It's not working though. What's that?
Yeah, Aboriginal and remote Aboriginal communities are the responsibilities under the National Vaccination Program of the Commonwealth Government, so I can't speak for them in terms of either their education program in relation to that cohort or about the actual rollout of the program. I do know that the Aboriginal Medical Services are well organised and have a good program to make sure that they can vaccinate people in their communities.
Minister, can I ask about some inconsistencies?
Look, the prioritisation is agreed with the Commonwealth.
The Chief Health Officer set out new PPE guidelines for health workers yesterday. Can you talk us through those changes and why they were made at that time?
No, I don't have a brief on that yet, but I'm very happy to provide that tomorrow.
Minister, can I just ask about some inconsistencies around the lockdown? We've heard from some physios they were allowed to continue to treat patients until midday Tuesday, when it was clarified they were not essential. Well, they weren't essential, and then podiatrists have still been able to work, and dentists have still been able to do emergency work as well. Can you explain that?
Look, and obviously none of this stuff is perfect, but what we try to do is make sure we minimise the risk. The directions are crafted in a way which means the police can work with different professions and members of the community to make sure that we can continue to minimise that risk. And obviously the Chief Health Officer with the Department of Health and police work with different professional groups to make sure that we have the appropriate arrangements in place. I'm not a public health expert, I can't provide you with that detail, but I'm very happy to provide a written response from the Chief Health Officer in relation to those matters.
Okay, but can you sort of see how it's different between a podiatrist working and a physio providing treatment till midday? It's not much of a difference, is there?
Well, again, I'm not a public health expert, but it has to do with the proximity that you're within the person, the extent to which you touch, the capacity for any fomites to be passed either through the air or by touch. From that point of view, I'm sure the health department are working closely with those professional cohorts to make sure they understand the risk and to make sure they manage it.
Question to the Premier?
Yes.
Given the case that came out today, all being linked to exposure sites that were identified from the outset, does the original strategy you were pursuing of not locking down, would that have been equally effective as at containing this outbreak?
Look, I think I remember making this point at the time, is that we're dealing with the Delta strain and we're dealing with an unknown threat. And from that perspective, as that that threat vector became known, we took the necessary action to keep the West Australian community safe. Just 48 hours ago, we had further cases, which were of the Delta strain, we believe, and represented a significant development in terms of this particular outbreak. So I'm very confident that the steps we took were proportionate to the risk as was being assessed at the time.
Under pressure.
Better for a period of time. Ambulance rounding has surged back past 5,200 hours in the last month. What's happening there? What are we doing to address the situation?
People are coming to hospitals in droves. They're coming in a way which they've never done before. They're coming with higher levels of sickness. They're coming with higher levels of mental incidents of mental health. And that's putting our hospital system, indeed every hospital on the East Coast, under severe strain. You address this through two different ways. One, to make sure you have more bed capacity, and two, to make sure you have the doctors and nurses to stand by by those beds, particularly at a time of workforce shortage. I've previously announced that we're increasing our bed numbers at the moment by 158, and that includes over 200. That includes over 100 beds that are already in service, with more coming on in July and August. We've also got the biggest intake of nurse graduates in the state's history. We will recruit 1,000 nurses this year and 1,000 nurses next year. Over 200 of those nurses are already on the wards today. But look, there's no quick fix to this. We are suffering the same fate of hospital systems right across the country. However, we are in a position to invest strongly because we've looked after the state's finances, and we are making sure that we open more beds.
How many contact tracers are working right now, and how under pressure are they?
Yeah, it's a good question, and I asked it this morning. We now have over 300 in the contact tracing team, and we're continuing to recruit more contact tracers. And in fact, we've had offers from local government authorities who have got staff that could serve in that role as well. So my understanding is the contact tracing teams are on top of the current workload, and as I said, we've surged up to 300 now.
Just back on vaccine.
Pretty consistent. So, and just to give you an idea of how we've surged over this particular one, we've had about 24, I think, in the contact tracing room on the Sunday morning. Now, and we've built that up to around about 300 today. So as you can see, we're really scaling up to make sure we stay on top of the tasks.
Just quickly on doses, is WA nearing the point where it will actually waste dosage? They're going to waste. I know there's an expiry for them, but has it thrown any out yet?
No, not that I'm aware of. And the way we would work with that is continue to liaise with the Commonwealth around supplies, so that, as you'd be aware, we've recently said to the Commonwealth, we don't need so much AstraZeneca, please divert that to our GP networks and our respiratory clinics. We're working closely with the primary health sector to make sure that we maximise the use of vaccines which are available to the state. Thanks very much, everyone.
Can I just clarify one quick thing? Just in relation to prisons, obviously there is a national approach to try and get both prisoners and prison officers vaccinated. The reason is, of course, they're in close proximity and they obviously can't escape that. Well, hopefully they don't escape that. And so prison officers, of course, have to go to work and they have to work with prisoners. So if COVID gets into a prison, what do? How do we deal with that? Can you imagine moving lots of prisoners out of a prison into a hospital, then having to take police off their duties and put them around hospital beds? It'd be a very difficult situation. So I think this is just a practical manoeuvre to try and make sure that both our prisoners and prison officers are kept safe, and we avoid the problem that would occur, big problem, if COVID got into a prison.
Given their situation that you've just outlined, will it be mandatory for prisoners to be vaccinated?
I don't know the answer to that, Jeff.
Should it be?
Well, I certainly think it should be.
So will you follow through and make sure that it is?
Well, I think it should be, but I just make the point, forcibly injecting someone is difficult. Obviously, our leverage over prisoners is not the same as our arrangements, say, in aged care or what have you, whereby, you know, it might be a condition for a position, for a job. But in any event, I'm pretty sure most of the prisoners want to get vaccinated because they know, pretty sure that most prisoners want to get vaccinated because they know that if COVID gets into a prison, it could be very, very difficult for them.
Premier, the confusion over vaccines that's evolved in the last 24 to 48 hours, do the premiers, do you take responsibility for some of that confusion, giving different messages to the Commonwealth?
Look, we just follow the health advice. I don't want to get into some battle or war with the Commonwealth over this. We just follow the health advice. As you know, the health advice came out that there should be rules applied for people under the age of 50 and then under the age of 60, in which they should only have Pfizer. That was the advice we received. That's the Commonwealth advice, that's the state advice. I just want to read out what the co-chair of the Australian Technical Advisory Group on immunisation, otherwise known as a TAGI, had to say. And he said this, his name's Professor Chris Blythe, he's West Australian, I understand. He said, our recommendation would be, based on risks and benefits, that younger people access Pfizer vaccines. And furthermore, he said, I do not believe at this stage that young people should be receiving AstraZeneca. Now, he said that today, so that's the health advice. So we just follow that.
He also said there's nothing stopping under 60s going to have a discussion with their GP about getting AstraZeneca, and you told that cohort not to do that yesterday.
Yeah, no, we just follow the health advice. The advice we had from the Chief Health Officer today and also from Professor Blythe is under 60s should have Pfizer. That's the advice we have.
Did the Queensland Premier, though, and in more particular the Chief Health Officer there, just completely up the ante, you know, sort of with these hysterical claims about people will die and basically the blood's on Morrison's hands?
Look, I've seen a lot of commentary about AZ over the course of the last 6 months or so. As I said yesterday, I've seen photos of blood clots on the front page of the newspaper. Obviously, that has made people vaccine hesitant, and so there is, you know, there has been a ongoing set of concerns raised. But best of my understanding, the Queensland Premier has followed the advice of her Chief Health Officer and the national body on these things. But as I said, I don't want to get in a war or fight about it. The Commonwealth's made a decision. It's their decision.
Have you asked for more? Have you asked?
In National Cabinet, I know you mentioned that the indemnity scheme was mentioned, but there was no mention of opening it up to under 40s. Can you just clarify?
To the best of my recollection, the Commonwealth just advised us that they were going to provide an indemnity for doctors, GPs, for people to receive AZ in the younger cohorts. It was just advice. It wasn't really a debate. It was just something they advised us they were doing.
Given your stance, have you requested more Pfizer?
Oh, the whole way along we've asked for more Pfizer, and we've asked for it to be issued more widely. As I keep saying, there is huge hesitancy now in the over 60 category. We've got to make sure we get them Pfizer as soon as we can. And we've also got to make sure that those people who've already had the first dose of AstraZeneca get the second dose, of which I'm one, and I will be getting the second dose. So we'd love to see more Pfizer issued, and we'd like to see it made available to over 60s.
What are our stocks like?
I think our stocks are pretty good, and all of the advice, I don't have the exact numbers, I think it's over 100,000 doses we have available. We're getting about 30,000 doses extra per week. But all the advice we have is, as of August, the supplies of Pfizer will ramp up significantly. And so that will mean that we're able to roll out far more Pfizer across the community.
Is it possible to manufacture Pfizer? Sorry, is it possible to manufacture Pfizer here in Western Australia?
Not as far as I'm aware. Look, in terms of manufacturing, the Commonwealth has there is a factory, the AZ factory in Victoria, that manufactures AZ. I think that's our only capacity as a nation.
Dan Andrews has today called for a discussion at National Cabinet to decrease the number of international arrivals. Will you back his call?
It's always a big concern. As you know, and I want to expand on this, it's the biggest threat vector. People coming back from overseas who are positive and therefore spreading it in a hotel. And we've done our utmost to make hotels as safe as possible, but there's still that risk. We had 3 positives come into hotel quarantine yesterday. You might recall around Anzac Day, April, we basically wrote to the Commonwealth and said we were going to take our numbers of returning Australians down from 1,025 per week down to 530 per week immediately, and the Commonwealth agreed to that. So we've significantly reduced our load, but it's still a big risk and a big threat. One of the problems, and I think I saw something about this on the news last night, is so many Australians have gone overseas over the course of the last 18 months unnecessarily. I think it's more than 100,000 unnecessarily. People book a conference somewhere in Europe and then have a holiday while they're over there and then come back and join the queue. It's just not right. We need to crack down on this. And I'll give you an example. In Western Australia, since March of last year, 51,000 people have arrived into hotel quarantine. We put 51,000 people through our hotel quarantine system. 1,308 of those people have been through hotel quarantine twice. 506 have been through on 3 occasions. 82 have been through on 4 occasions. 8 have been through on 5 occasions. And 2 have been through on 6 occasions. So in other words, there's a large group of people who are going overseas on multiple occasions. And every time they go overseas, they increase the risk. Now, they also displace people who might have been isolated overseas since the beginning of the pandemic. And it means they can't get home because there's not a seat on an aircraft or not a spot in a hotel. So this is a big problem. And until we're all vaccinated, we really need to crack down very, very, very heavily on the number of Australians who are permitted to go overseas. Now, there may be circumstances, I know there are. If someone has to go overseas for some urgent reason, and there are those reasons every single day, well then that's acceptable. But the idea you go overseas to do a course at a uni, or you go overseas to go to a conference, or you go overseas for a business meeting, and then you tack on a 4-week holiday, it's just wrong, and it shouldn't be happening. I'll just say to the Commonwealth, this is the biggest threat vector to Australia, and it needs to be cracked down on now.
Just on those statistics you just read to us since March last year in hotel quarantine, I assume a lot of those would have been because of the interstate border. There would have been interstate travellers who've had to go through the hotel quarantine system multiple times.
No, they're people who want overseas.
You sure? So
that's the advice I've been given.
So they're not interstate at all. Okay.
What would you say to those 2 people who've spent 3 months of their life in hotel quarantine?
Surely there's better uses of your time. They must really like hotel food. But it is. Look, it's not. Look, I assume someone like that is some sort of FIFO worker. I would assume. But as I said yesterday, going off to Africa, working FIFO in the middle of a pandemic, where we now have many of our cases coming back from Africa, just has to stop.
Premier,
if I can finish.
Yeah.
We have plenty of jobs here. People need to look for work here. One of the biggest issues we have is not enough people for the jobs we have. In the middle of a pandemic, we need to keep people home, except for the most urgent of reasons. School
holidays start at the end of the week. There are businesses around the state that are relying on that sort of trade. Can you give any indication, any hint that people will be able to do that, to travel and to take up their holiday accommodation and move around?
We'll be able to make an announcement on that tomorrow. I expect later tomorrow we'll be able to make a final decision on that based upon testing numbers and the outcomes overnight. So I can't give any indication at this point in time.
Premier, any indication on compensation for businesses? Has Treasury come up with any figures yet?
No, as I said yesterday, we don't know how long or how extensive the lockdown will be until tomorrow at the very earliest, and then it may well be there's a step down in measures. So until we get all of those facts before us, we can't make any announcement about compensation measures.
Should people in Perth who have holidays planned in regional areas cancel their bookings?
Well, I can't advise on that till tomorrow. I know this is very difficult, and the timing of this is awful, considering the school holidays. And I know there's lots of people who've just recently had to cancel trips over East, holidays over East. Now it's confusing about whether or not they can have holidays around the state. I understand that is a big issue. Hopefully we'll provide some guidance and resolution to people tomorrow.
Are you comfortable with the police decision to arrest a homeless woman for not wearing a mask on Barrack Street on Tuesday?
I don't know anything about that, I'm afraid.
Does that sound consistent
I
with the
don't.
touch?
Yeah, but hold on. You posed something to me. I don't know what the circumstances were. There may have been other issues involved.
You mentioned that some tourists have entered regional and remote communities. Are they from Perth? And what communities have they entered?
I don't know where they're from, but I do know it's in the Kimberley. So, as you know, up there, there's often signage saying don't come in. There's rules around people not being permitted to come in. Essentially what we've given is a blanket ruling that you shouldn't go into remote Aboriginal communities unless that remote Aboriginal community has made a informed decision to allow you to go in. So if people are breaching that rule, they're endangering the lives of people in those communities, and they're breaking the law, and they shouldn't do it. Now, the reason we are so concerned about this is the history of pandemics and Aboriginal people is that Aboriginal people are far more susceptible to viruses and far more likely to die. And so therefore, we're very concerned to ensure that they are protected.
You're considering the support.
So the AHPPC are looking at this, but do you believe that, or do you support incentives being offered to people to get the vaccine? So home quarantine rather than hotel quarantine, that kind of stuff?
Not that incentive. I think we should look at incentives, and we've been working on that for a considerable period of time. At this point in time, our vaccination clinics are pretty full with bookings, but in due course, I think we should look towards incentives. Whatever it is, I don't know. You know, I know America offers people a donut and coffee. That seems to be a very American solution. But whether or not we do something in terms of offering incentives, that's something we can work on. In terms of home quarantine as opposed to other forms of quarantine, that would only apply for people returning from overseas. I actually think there is a strong argument that before anyone can go overseas, they should be vaccinated, and then we should actually crack down hugely on the number of people being permitted to go overseas. So I think that's a first step we can take to protect ourselves.
You're considering support for small business, but what about households or individuals who have lost a week of income, like retail workers or, yeah.
It's a big, that's an issue, because there's a resolution of National Cabinet of maybe a month ago that income support would be a Commonwealth responsibility and small business support would be a state responsibility. Now, the Commonwealth income support only kicks in if the lockdown is over 7 days. So in a way, it incentivises lockdowns to go longer. So that wasn't a problem we foresaw when we came up with that arrangement, but that's what it does. That sort of support for casual workers, for employees who might be stood down, is the Commonwealth's responsibility under the agreement made at the National Cabinet. It's a problem. You know, if the lockdown is less than 7 days, obviously we will put in place measures to support small businesses, but the Commonwealth obligation only kicks in after 7 days.
Could you lobby at National Cabinet to reduce that 7
Well,
days?
we can. The only thing about it is the administrative, I assume the administrative arrangement or burden, if you like, would be quite large to work all this out. I think it's just better that we resolve these things, lockdowns, as quickly as we can. But certainly this is an issue I'll raise on Friday, I think tomorrow. This is an issue I'll raise at the meeting tomorrow.
Premier, what's your reaction to the iron ore price surge and what impact it will have on the WA surplus?
Well, the state is in a good financial position, and what the position we're in means is that we're able to fund initiatives to keep our state safe and to ensure that our economy is strong. So we put in place $7 billion worth of response measures to COVID, whether it was tax cuts, freezes in electricity prices, whether it was keeping electricity and water prices low, whether it was capital works, whether it was COVID medical responses, about $7 billion worth of initiatives we put in place. And that's because we've kept the finances and the economy strong. So that's the benefit of this. What I don't want to do is blow it. I don't want to be in the situation that New South Wales is in, that the Commonwealth Government is in, with decades of debt and deficit ahead of them. I want Western Australia to be the strongest state in Australia and continue to be the strongest state in Australia.
Premier, the family of Giuseppe Racco, who was died as a result of a one-punch, want what the government to introduce what they call a coward's collar. So anyone found guilty gets 10 years mandatory jail, and then a long period ban from entertainment districts and hotels anywhere alcohol is served. Is that the sort of thing that the government would consider?
Look, like everyone, we have enormous sympathy for the family. This was an appalling crime and a terrible outcome for the family and to Mrs. Racco and the entire family. Obviously, we have the deepest sympathy. I actually went to the site the next day and met with some of the police officers there, and it was just a terrible scene. So it was very, very sad. The most important thing I think that's going on here is the Director of Public Prosecutions is going to appeal this penalty. So the court will be able to work out whether or not there needs to be a more severe penalty imposed on the offender. In terms of bans from entertainment precincts, I think that's an idea worth considering. Currently the Director of Public Prosecutions, currently the Director of Liquor Licensing can ban someone from licensed premises or certain licensed premises. But this crime occurred on the street, so they weren't actually in a licensed premise. So the expansion of that capacity to ban to a precinct, I think is worth considering, and I'll get some advice from the Attorney General and the Police Commissioner and others to see whether or not that's something we can implement, whether or not it's been implemented anywhere else.
You don't seem, though, to be favourable or look favourable on some sort of mandatory aspect of sentencing where the victim dies.
Well, obviously, it's a difficult thing because there's numerous circumstances around these sorts of offences. Sometimes it could have been a fight. Sometimes it could have been a situation whereby someone was responding to a taunt from someone else. There's multiple circumstances. And so it's a very difficult thing to do, but I understand that the family is very upset, and I understand that the DPP is going to appeal the penalty with a view to getting a more severe penalty, and obviously the court will make that decision based upon the circumstances.
Do you intend on releasing the interim Crown Royal Commission report?
Oh, eventually. Obviously it hasn't been to Cabinet yet. These things always go to Cabinet first. I haven't seen it. I just know it's arrived. Once it goes to Cabinet and we've been able to consider it, I'd expect we'll release it.
A recent announcement regarding the joint initiative to build a dedicated quarantine facility. Has there been any progress past the announcement in terms of the assessment process?
Yeah, I wrote back to the Prime Minister saying we would join in the assessment process. The process for selecting a site is going to commence tomorrow. That's the land assessment process will start tomorrow. And we have two sites to choose from, which is both Perth Airport and Jandakot Airport site. Now, there's multiple sites on those sites, so that process will be undertaken, and the consultation, if you like, or the seeking of information on that issue will start tomorrow. So we're moving as quickly as we can. So once the site is selected, once all those things are done, the Commonwealth will need to build the facility, and we'll work out an MOU with the Commonwealth about the operation of the facility at that point in time.
So just to be clear, you're saying it's the Commonwealth's responsibility not just to pay for the construction, but to actually oversee and lead the construction?
Oh, I would have thought so. Look, that's the offer, well, that's the arrangement, as I understand it, that they build these things. Quarantine is actually their responsibility. So they build it, the view is that the state will operate it. Obviously, we'll have to work out an MOU as to how it would operate and the like with the Commonwealth, and that's something we'd seek to do.
Just two COVID questions. The Sydney and now Perth lockdowns all trace back to an unvaccinated driver who was transporting international flight crews. A week ago, you said you were going to get advice about mandating vaccines for the drivers in this state. Did that happen?
Yes, I think they're all vaccinated.
Yes, so 100% of one particular, this is for flight crew drivers. Yeah, so all our PTA employees are vaccinated.
Yeah.
100% of one particular driving company vaccinated, 80% of the others, and they're just doing a bit of mop-up of a couple.
So no need for mandatory for that
No.
cohort then?
The advice we have is there's two transport services two companies. I think it's Hughes and Valentino's. One is 100% vaccinated, the other one is, and bear in mind they turn staff over, so as new staff come in, they may not be vaccinated, they have to be vaccinated. So I understand they're both moving to 100% vaccination, and all of our public transport drivers are vaccinated. They're all required to wear PPE. There's all sorts of protocols in place. We understand that as a risk vector, and we're very attuned to trying to make sure that we do everything we can to protect both the drivers and the general public.
Last one, The Guardian yesterday reported that at National Cabinet you expressed frustration at having to explain the changing AstraZeneca advice to the public. How accurate is that National Cabinet leak?
I don't know who's said that, but I'll say what I've always said, which is that I think we should go to Pfizer for above 60s as soon as we possibly can, because we're obviously going to get there at some point in time. So considering we're going to get to that point, we should move that point forward so we get more people over 60 vaccinated as soon as possible. Thank you. I think we'll come back in a moment with some of our experts on voluntary assisted dying.
Thank you.
Thanks, Premier.